Hi everybody, I'm Andrew Lekarczyk. I'm a medical student at the University of Michigan. This project was done by me for my student colleagues and our PI, Dr. Reddy. So essentially today I'm going to be giving you a brief presentation on the surgical repair of hiatal hernias, specifically comparing the robotic assisted approach and the traditional laparoscopic approach. So just moving on very briefly, here are our disclosures. So, robotic surgery has grown dramatically in prevalence over the last few decades. Especially in the last few years or so, the popularity of this technology has really increased. But the cost effectiveness of this approach remains a very understudied question. So, to put it frankly, does adoption of the robotic assisted approach significantly decrease hospital profits and increase hospital costs? So to answer this question, we obtained a database of 73 patients at our institution. 42 underwent laparoscopic paraesophageal hiatal hernia repair, and 31 underwent the robotic approach to the surgical technique. So displayed in table 3 here, you can see the results. So although the robotic approach was associated with a significantly higher patient charge, there was no difference in payment or hospital costs. Interestingly, the supply cost was significantly greater for the robotic approach, but in the end, this did not statistically affect the net income. And you can see these results displayed in graphical form as well. So in conclusion, although the robotic approach is associated with a greater supply cost compared to the traditional laparoscopic approach, in our study, this did not statistically significantly affect hospital profits. However, individual programs need to understand their own costs, their own payer mix, as well as their ability to recoup some of the higher technology costs associated with this robotic approach before deciding to pursue more robotics or more traditional laparoscopy. So further work will kind of generalize to more surgical procedures, not just hiatal hernia repair, as well as involvement of a larger patient population. And finally, here are just some supplementary results showing that there was no real difference in terms of patient outcomes between these two approaches. And with that, thank you very much.
Thank you very much.